RQF BTEC Level 3 in Health and Social Care. This is for Unit 7, Principles of Safe Practice in Health and Social Care. This focuses on Learning Aim C, investigating the influence of health and safety legislation and policies in health and social care. For your coursework, it's really important that you're aware of the health and safety legislation and policies in health and social care. You will need to take time to research the following policies: Health and Safety at Work Act, Data Protection Act, Care Act, Care Standards Act, Equality Act, and the Care Act. Other relevant legislation is the Manual Handling Act, the Food Hygiene Regulations, and Control of Substances Hazardous to Health. For information on each of these, you can look in your textbooks or research the internet. Stop the PowerPoint now and have a go at researching each of these very briefly, making notes on each. We're now going to look at the CQC, the Care Quality Commission. The CQC they're like inspectors, Ofsted inspectors for schools, but they do this in health care settings such as a doctor's surgery or a hospital, even care homes. So the CQC introduces a range of standards to improve the services offered by health and social care providers. The CQC can inspect your workplace, look at what you do, how you do it, and also ask you about your training and competence. They are independent of care providers, but they work with them to improve the quality of care provided. The CQC can issue warning notice with deadlines for improvement. So, for example, if it goes into a care home and is not happy with the care provided, for example, there are health and safety risks, it can actually issue warning notices where the care home will have to improve with immediate effect or they will have to close. So it can impose special measures. There are 13 fundamental standards in the CQC framework. They follow the Francis Report 2013 into the care delivered in hospitals in the Mid Staffordshire NHS Foundation Trust. So it's worth having a little look on Google and finding out what those 13 fundamental standards are in the CQC framework. The Disclosure and Barring Service. The Disclosure and Barring Service, which is DBS, helps employers make safer recruitment decisions. These are background checks on their employees to make sure that they are safe to work with the vulnerable people that they're going to be responsible for. For example, the elderly, young children, people with mental health problems, special needs. It's to make sure that they haven't got anything in their past that could affect the way in which they work with young children or perhaps adults. So, for example, if they've got any sexual assault or physical assault that they've been arrested for and criminal records for, it's to make sure that they haven't got any of those. They are going to be completely safe working with the people within their care. This actually replaces the CRB, which is the Criminal Records Bureau check that used to come before it. I'm now going to discuss the influence and legislation and policies on health and social care services. Lots of these legislation and policies are there to help safeguard the people that we're caring for. In our jobs, in health and social care role, you are safeguarding vulnerable adults, children and young people. The person you're looking after has the right to feel safe and secure in your care. However, there should also be safeguarding to protect you from allegations. It's important that you work in a way that your professionalism is never questioned. You need to communicate clearly, and you need to make sure that your service user does not have the opportunity to misread a situation. Protection from accidents, injuries, illness, including infection control, food prep, and hazardous substances. The HASAW Act 1974 requires employers to ensure the health and safety of all employees and anyone that is affected by the work of that organisation. Employees have a duty not to put themselves or others in danger. That's vital. As a carer, you must use the equipment in the correct manner, whether it be a hoist or antibacterial gel. You should be trained on how to use things like a hoist appropriately, and you should make sure that you're aware of all the hygiene processes in your workplace. You should follow the instructions on any piece of equipment that you use. For example, you should not fill a sharp spin beyond the line indicated, because the person collecting it could then be placed at harm. Managing risk assessments and maintaining a safe working environment. including safe moving and handling. Before you start any task, you need to ask yourself, is this task really necessary? Could it be made simpler and safer? For example, if you work in an elderly residential care home and you have a resident that needs to get out of bed, but rather than actually just hurting yourself to help them get them out of bed, if there's a hoist available, use it. It's safer. So remember ELITE. E equals environment. Is the environment dark or cluttered? Load. Is the load stable, slippery or awkward? I, individual capacity. Are you equal to take the task? T, task. Is it possible to break down one large task into a couple of smaller ones? Equipment. E, is it designed for the task you want it to? By considering all of these before carrying out, actually lifting, carrying, moving, handling, could actually help make your life easier and reduce any injuries to you. Promoting health and well-being, including handling medication. You should always encourage your service users to have a healthy lifestyle. Doctors will often do this, nurses, domiciliary care, and if people have a healthy diet and exercise, they will be less likely to get ill. We now move on to handling medication safely. It's important as a nurse, or a doctor, that you must never handle medication until you are trained to do so. There are many rules governing the safe handling of medication, and errors can cause complications, even death. You will often find on wards nurses that are handing out medication. Some of them now even wear a vest to say, please do not disturb whilst handing out medication. It's so important that they make the right checks to ensure that patients are receiving the right medication. If you don't quite understand a doctor's handwriting, you should always check it. And for example, you have to make checks such as, even though someone may have a bracelet with their name on it, you are expected to ask their name, the date of birth. You need to check that against your records. You need to make sure that the medication you're handing out matches what is on your sheet. It's vital. The wrong medication can make a person very ill. If you want to find out more on this, if you read page 333 in the BTEC Health and Social Care student book, that may help give you more guidance. Providing confidence and reassurance for families and other carers. Service users will have expectations about your conduct and performance as a carer. They will often need reassurance. You should never promise them that it will be all right. You should act professionally when providing care and do not lose your temper. Be polite and considerate. It's important that service users have confidence in your competence. Gather as much information as you can before deciding on the best course of action. Meeting legal and regulatory requirements, including record keeping. When you work in health and social care, you will be expected to fill in lots of documents about service users that you have, and they will be expected to be detailed, accurate, and up to date. Accurate record keeping is vital for effective continuity of care. If a service user requires the input of a number of carers and services, it's important that each service is aware of what the other has done. So you must record what you've done so that other people can see it, that are also working with that individual. Your employer will have regulations covering clear and accurate record keeping, and it's important that you follow the procedures. You will be expected to abide by the HASAW Act, and you have a duty to maintain a safe environment and report any incidents and accidents that could endanger others, and see that the information that you have witnessed is actually recorded. Working in health and social care. To recruit the right people, you have to be an effective care practitioner. You need to think about how the 6 C's apply to you. Employers will be looking for staff who have an understanding of their job role and a range of coping strategies for the pressures faced by people working in health and social care. This job is a high-pressure job. They are looking for people with good character, integrity, and a real desire to support service users. It's also really important to be able to meet the care needs of people that you do not like. You're not always going to come across people who you get on with, and it's really, really important that you learn ways in which you can cope with those people perhaps being rude to you, or being particularly nasty. And people may have done terrible things that you're expected to look after. For example, someone may have undertaken a criminal act and you were the first person to have to deal with them after that. So you have to remain professional at all points, regardless of what the person has done in front of you. When you work in care, you have to ensure the needs of the people are met, regardless if you get on with them or you don't. Just a little bit of further information on the DBS checks. DBS checks were introduced due to the murder of Holly Wells and Jessica Chapman in 2002. Their caretaker undertook the murders, and it led to the establishment of a CRB system in place, being put into place, because had they have undertaken a background check on the murderer, they would have found out actually he had a not a very good past, and he probably would not have been employed. By March 2012, figures from CRB revealed that 130,000 unsuitable people, including paedophiles and rapists, had been prevented from working with children, and so the CRB is now called DBS. This is how important this check is. However, it's still important to remain vigilant, as DBS will only show up offenders that have come to the attention of the authorities. So you'll only know about those ones that have been caught. It will not reveal offenders that have not been reported to the police. And also, someone could have had a clean DBS and then in the near future carry out a crime. So it's only effective up to a point.